The second topic for today is metabolism of fluorides. So the fluoride metabolism can be divided into three phases. First is the phase of absorption, then the distribution, and finally the elimination. So before going into the metabolism, what is the role of blood plasma? So blood plasma acts as the central compartment into which the fluoride must pass before it is distributed and eliminated. So that highlights the role of blood plasma in metabolism of fluoride. So the overview of metabolism of fluoride is it follows a two-compartment open model. That is, there are two compartments. The first compartment is called the central compartment and the second compartment is called the peripheral compartment. So as soon as the fluoride is ingested, it is absorbed into the central compartment, it is distributed to the peripheral compartment, and it is transferred back to the central compartment from where it is eliminated. So this model is known as the two compartment open model, which is used to describe the metabolism of fluoride. Coming to the absorption of fluoride, the routes of absorption is mainly through ingestion. So whenever fluoride is ingested, it is absorbed via the gastrointestinal tract, or rarely fluoride can also be inhaled from airborne fluoride, or it can undergo a biotransformation. Usually some anesthesia, general anesthetics like isoflurane or halothane can undergo biotransformation and release fluoride. This could be another route of absorption of fluoride. The rate and degree of absorption, fluoride is rapidly absorbed. The rise in plasma fluoride concentration occurs within minutes of ingestion. The height of plasma peak is directly related or directly proportional to the dose ingested. It is directly proportional to the rate of absorption, and it is inversely proportional to the body weight. The readily soluble compounds like sodium fluoride are completely absorbed, whereas less soluble compounds like calcium fluoride, magnesium fluoride, and aluminum fluoride are not fully absorbed. The plasma peak usually occurs within 30 minutes of ingestion of fluoride. Next, what is the effect of food? So whenever there is a presence of food, it retards the absorption of fluoride. So usually when fluoride is taken fasting, there is 100% absorption. When it is taken with a glass of milk, it's only 70%. Or when it is taken with a calcium-rich breakfast, it is only 60%. So whenever there is a presence of calcium in the food, that greatly reduces the absorption of fluoride into the body. Next, coming to the mechanism and site of absorption. Usually the absorption takes place in the stomach and intestine. It is by a procedure known as passive diffusion. That is, it moves from the high concentration to a low concentration. It depends on the gastric acidity. The more acidic is the atmosphere, the more rapidly this is absorbed. That is due to the formation of the hydrofluoric acid. That is, the H plus ions from the HCl present in the stomach reacts with fluoride ion to form HF, hydrofluoric acid, that passes through the membranes and gets absorbed. If it is not absorbed from the stomach, the absorption takes place from the intestine. Now, what is the amount of fluoride in blood plasma? As I told you earlier, plasma is known as the central compartment, and in plasma, fluoride exists in two forms. First is the ionic form and the second is the non-ionic form. The ionic form is also known as the free form and non-ionic form is known as the bound form. The normal plasma fluoride levels is 0.7 to 2.4 micromoles per liter. The pharmacokinetics of fluoride is affected by absorption, soft tissue distribution, and mineralized tissue uptake and the renal excretion. All these processes occur simultaneously. So the pharmacokinetics can be otherwise explained by plotting a plasma concentration curve that looks like this. So this is a curve that is plotted on a semi-logarithmic scale which shows three phases. As soon as the fluoride is ingested, initially you can see an increase. This is known as the initial increase. Then you can see a rapid fall and then there is a gradual fall over time. The initial increase is mainly because of the absorption of fluoride from the GIT. Earlier it was told the stomach and intestine are the sites where it is absorbed, and this follows the first order kinetics. Next comes the alpha phase. So this is the alpha phase, that is, and then you have the beta phase. So alpha phase is when the fluoride is rapidly distributed to the well perfused soft tissues, or soft tissues which are having high blood supply, and that forms the heart, kidney, liver and bone, which are called as the central compartment. Later it is slowly distributed to poorly perfused tissues, and that is the skeletal muscle and the fat, and that is known as the peripheral compartment. And finally, it comes to the central compartment, that is when it is called as the beta phase, or the phase of elimination. So the net efflux from peripheral to central compartment, and then it is eliminated from the central compartment. The rate of elimination is related to the half-life, which ranges from 4 to 10 hours. The distribution of fluorides, so that is about absorption. The next is distribution. Distribution first occurs in the soft tissue. When we talk about the soft tissue, it is distributed to all tissues and organs, and the rate of distribution is determined by the blood flow to the organ. So this table shows the tissue to plasma fluoride concentration. The highest is the kidney, and the next is the liver. So this is directly proportional to the perfusion of the soft tissues. So the least here is the brain. Next is when you are talking about distribution to mineralized tissues, it has a high affinity for mineralized tissues. Almost 99% of whatever is there gets absorbed into the mineralized tissues, and this can take place in either bone or teeth. That is the reason we see dental fluorosis and skeletal fluorosis. We'll be discussing about fluorosis in detail in another unit. So fluoride has an affinity for the mineralized tissues. When you talk about the fetus, earlier there was a controversy regarding the transfer of fluoride across the placental barrier. Earlier it was thought that placenta acts as a total barrier and that fluoride does not reach the fetus. But now it is proved that placenta is not a total barrier. At high concentrations, it partially lets fluoride to pass the placenta barrier. So placenta is actually a partial barrier. At high concentration, it allows it to go through the barrier or pass through the placenta, and at lower concentration, it acts as a total barrier. That is the current evidence, it says. So 75% of serum fluoride of the mother goes to the blood, and from the fetal blood, it reaches the mineralizing bones and teeth, and that explains the possibility of dental fluorosis in primary dentition, which completes the formation in utero. The intraoral variations, when you talk about how fluoride is distributed in the teeth, the maximum fluoride concentration is found in the cementum, followed by enamel, and then followed by dentin. And in enamel, the highest concentration of fluoride is in the superficial surface, and as you go deep, the concentration reduces towards the dentino-enamel junction. In the dentin, the highest concentration is on the pulpal side because that is well perfused, and that again decreases towards the dentino-enamel junction. And in the saliva, always fluoride is more when the saliva is resting, when you collect a resting saliva compared to a stimulated saliva. The third is the excretion. Excretion is mainly through kidney, breast milk, feces and sweat, and the renal clearance rate is about 30 to 50 milliliters per minute. And finally, coming to the biomarkers of fluoride. So these are biomarkers in the sense, where do you assess the level of fluoride? What are the substances you use to identify the amount of fluoride in a person's body? The biomarkers can be classified as contemporary biomarkers, historical biomarkers, and recent biomarkers. The contemporary biomarkers are urine, plasma, and saliva. The historical biomarkers are bone and teeth, and the recent biomarkers are hair and nails. So with that, we come to the end of metabolism of fluoride. Metabolism of fluoride can be rarely asked as a short note question. Just remember that it follows a two compartment open model. There is a peripheral compartment, there is a central compartment. So it is absorbed into the central compartment, distributed to the peripheral compartment, comes back to the central compartment from where it is eliminated. And what are the factors that help in absorption? What are the factors that decrease absorption? How it is distributed, and finally how it is eliminated. So with that, we wind up this unit on metabolism of fluorides. Thank you.